patient will be seated with their affected arm on the table. PT will then apply ultrasound gel to the end of the probe.
So now we're going to discuss about the specific details of the ultrasound machine. So as of earlier, we talked about turning on. Here is the button that we use to turn on the machine. The machine is currently on. Now we are going to turn on the ultrasound setup right here. Next thing what we're going to do is to make sure that we do to the correct hertz. So in our specific example, we wanted 3 for superficial heating. We wanted a thermal effect, so we put the duty cycle to 100%. Afterwards, we go and we put the time in anywhere from 10, or if you wanted longer time, then we could put for 15 minutes, depending upon the time that you want to place upon this modality. Next, we have intensity. So after we hit start, we can adjust the intensity anywhere from 0.5 to 2, just depending upon the patient's preference. Last button to hit, and make sure prior to hitting the start button that we place this ultrasound with the gel on the patient so that we don't obstruct or injure or damage anything on the machine. You hit start, and then you can hit stop anytime that you need to change any sort of the settings, change intensity, or any of the such above.
For the parameters, the physical therapist will start by turning on the ultrasound machine and setting the parameters as follows. We'll do 3 megahertz for superficial heating due to the superficial placement of the lateral wad tendons of the forearm. For duty cycle, we will go with continuous or 100% for uninterrupted streams promoting thermal effects. For the intensity, it is set to the patient's comfort level, keeping it between 0.5 to 2 watts per centimeter squared. Time is set for 10 to 15 minutes. The effective radiating area is 5 centimeters squared for this specific probe.
The PT will move the probe in a circular pattern to prevent from hotspots. Some contraindications include pregnancy, malignancy, thrombophlebitis, pacemaker, and you also want to avoid the eye or reproductive organs. Some precautions include acute inflammation, epiphyseal plates, and fractures. Burns can be caused by not moving the sound head over an area as well.
Prior to applying ultrasound, the PT will palpate the lateral epicondyle to ensure proper tissues are receiving treatment. Once the correct area of the arm is located, the physical therapist will place the probe on the patient. Next, turn the machine on and begin treatment. The PT will move the probe in a figure 8 or wave pattern. It is important that the physical therapist keeps the probe moving to prevent from hotspot formation within the tissue. Additionally, it is important to avoid bony prominences because it can result in periosteal burns. In this case, it is important to avoid the olecranon, lateral epicondyl of the humerus, and the head of the radius.
How's this feel, Nick?
It's a little achy. You could probably turn it up a little more.
Okay.
I don't know if that's placebo or if I'm actually feeling something.
Well, we'll just change this intensity to when you think it feels the best.
That's probably good there.
That's good right there. And how does this feel as it currently?
Feels fine.
A lot better than it was?
Yeah.
You feel like it's reducing your pain?
A little bit, slightly.
Great, great.
With this specific intervention, the physical therapist expects to reduce pain to the lateral tendons via thermal effects of ultrasound.